Hi, I'm Dr. Julie Steinauer, and today I want to answer a question that came to us from someone who asked a question on one of our social media sites about vision and does vision change when you're taking oral contraceptives or birth control? I thought that was a really interesting question and something that we hadn't seen I don't think ever, or at least not very often. So I decided to do a video on that, talk about it a little bit with you. Now, before we go into those details, I do want to tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. Two options there. You can either click on the questionnaire. It is newly revised and revamped and really cool. So if you click on that, anyone can take that questionnaire, but it will give you kind of some information at the end of the questionnaire. And the other option for you is to click on the schedule consultation button. If you're ready to consult with me, maybe you've watched 200 of my videos or something, then it's maybe time to consult with me and talk about how we can help you with your vision. All right, so let's go back and talk about oral contraceptives or birth control and how that can actually affect your vision. Now, I do have a couple of notes. There are some things I really want to be specific in making sure that I cover with you, but some of these things I didn't know and I had to look up, and I was like, wow, that's really very interesting. Okay, so estrogen, which is the basis of most contraceptive pills, can cause inflammation within the eye. It can cause an increase in the corneal thickness, which is the front surface of the eye that a contact lens would fit on if you wear contact lenses. It can cause dry eyes, which that's really, really common. We definitely know that. And blurry eyesight, which can be a result of the dry eyes, but can also be a result of the changes in the corneal thickness and obviously eye inflammation. But here are a few that I didn't, one more that I was aware of, which is light sensitivity. If you do have a problem with dry eyes, you definitely can have some issues with light sensitivity because the surface of the eye being dry, and when light hits it, especially like maybe an oncoming headlight of a car when you're driving at night, it can just kind of cause that light to spew and disperse, and that can be kind of uncomfortable. Now, here were two that I wasn't all that aware of. Actually, three. Okay, so are you ready for these? An increased risk of glaucoma. I didn't know that, but here's kind of what goes along with that and maybe why it's occurring, is that there's a decrease, an increase in the eye inflammation, which is possible, an increase in the corneal thickness, and there's also another thing, which is a decrease in the retinal thickness that can possibly occur for patients who are on oral contraceptives for a period of time. Now, the information that I read wasn't specific as to was it happening if you're on it for a year, or if you're on it for 10 years, but my inclination would tell you if you're on it for just a year, the chances of these things happening is a lot less than if you're on it for 10, 15 to 20 years. So use your judgment and figure out what you need to do on that. But another condition that I wasn't totally aware of was possible macular problems, like macular degeneration. Obviously, these medications are used, oral contraceptives are used all over the place. A lot of people use them when they're not wanting to get pregnant and have a baby. So use your judgment as to whether or not they're good for you and what, weigh your kind of risk to benefit ratio. Definitely they have their place for certain, but just kind of weigh those things in relationship to how long you would maybe need to be on them and how it could possibly affect your vision. So again, I thought this is a really interesting topic. I can't remember the individual's name who reached out to us because we just get flagged by so many people asking us questions every day. But I do want to say kind of a blanket thank you to them because it is an important thing to think about. We don't realize, and maybe some women who are taking oral contraceptives are wondering, like, why are they experiencing so many changes with their vision? Well, this may explain and give you an answer as to why that might be happening. Obviously, always go visit your optometrist and find out what's going on. If you are experiencing any kind of changes, whether it be because you started an oral contraceptive or maybe you started another medication, even an antihistamine can cause different problems with vision. So definitely check with your doctors and make sure they are aware of what you're experiencing. And also be sure to look into them just to make sure there's not something more serious going on. Now, we are on lots of different social media outlet. So go visit us and find us on, obviously we're here on YouTube, we're on Rumble, you can find us on LinkedIn and Facebook, and more places to come during this next year. Now, with that said, please like and subscribe to our channel if you've not done that already. Like the video and subscribe with that bell icon so you get all notifications. That way you don't miss any of the cool topics that we talk about, and unusual topics at times, kind of like today. Thank you.